A tooth, multiple teeth, or mouth area can be indicated on a clinical note and filtered for in patient history. The user wants a quick way to identify which teeth or mouth area a clinical note relates to, and to be able to search all clinical notes that have to do with that specific tooth or mouth area. This feature saves the user time in searching through clinical notes to find related information. This feature does not replace the need of documenting tooth numbers or mouth areas in clinical note fields, nor is it included in revision history. This feature only provides the ability of being able to identify and filter clinical notes related to the tooth or mouth area. When a clinical note is opened, under the patient name is a field labeled Teeth. This has the Select Teeth button that is on each clinical note. Click on the Select Teeth button next to the field. The tooth and mouth area selection buttons display. When a tooth number or mouth area is clicked, it will turn blue indicating it is active. A single tooth or multiple teeth for the same clinical note can be selected. Click OK, and the teeth and mouth areas will display in the teeth field. Mouth areas, such as quadrants, arches, or full mouth, can be selected. Click the Clear button to clear any active buttons. Click Cancel to cancel the selection of teeth for the clinical note. Click OK when done selecting teeth. If the user wants to select both mouth areas and individual teeth, it is easy to do so by clicking the mouth areas first, then the individual teeth. The selected teeth and mouth areas will display in the teeth field on the clinical note. There is a reminder under the Teeth field indicating that the teeth selector is not part of revision history. Complete the clinical note with the information needed, including applicable teeth numbers and/or mouth areas. Save the clinical note when done. In patient history, the selected teeth and mouth areas will display in the tooth column. This column is filterable using the tooth filter in the upper right of the window. Clicking the drop-down menu of the tooth filter will give you the option to filter for permanent or primary dentition, or even supernumerary labeled SN. For example, if you filter for tooth 3, all clinical notes and procedures for tooth 3, upper right quadrant, and the upper arch will display in the grid. If you want to see all clinical notes and procedures for the specific quadrant, just filter for any tooth within the quadrant, such as tooth 32, to see all lower right quadrant information. Filtering for supernumerary clinical notes or procedures is done by selecting SN. Any clinical notes or procedures for a supernumerary will display. Any clinical note that has a tooth or mouth area in the teeth field will print on a detail form. Click on the Reports menu and select Detail Form. At the top of the clinical note will be all teeth and/or mouth areas that were selected. Now you know how to select teeth or mouth areas on a clinical note. Thank you for choosing Daisy. If you have any questions, please call us at 1-800-368-6401.